There's also changes in the proportions of muscle and fat throughout the body during this period. You have an increase in body fat overall and loss of muscle. In addition to that, fat tends to build up in specific areas. Like for men, it tends to build up kind of on the back and the sides. For women, it sort of builds up in the stomach and the thighs. And this is sometimes referred to as middle-age spread. So you have fat gain in the torso. Women also have some increased fat in the upper arms as well. Like I said, muscle mass declines overall. That happens pretty gradually. This, of course, can be offset by exercising frequently, especially resistance training like lifting weights, things like that. And then, of course, diet also plays a role in the accumulation of fat and muscle as well. So I just said diet plays a role. Diet can also affect a lot of other aspects of health in aging. It's actually been shown that having a calorie-restricted diet during this middle adulthood period can cause all kinds of health benefits, both physically and cognitively and mentally. There's some really conclusive studies with rats and other animals that show if you decrease the amount of calories that you give rats by about 30 to 50% in their later adulthood period, then it can reduce all kinds of rates of chronic diseases and also increases their lifespan by about 50%. So pretty drastic outcomes that you see in rats. There's been non-human primate studies that show pretty similar results. Most of those studies show increased health benefits during those older years, but they don't necessarily have quite the life-extending capacity that you see in like rats and mice. And then, of course, with humans, it's much harder to carry out studies like that. It's harder to recruit participants and control what food they're eating and how much. So most of the studies with humans are more correlational. It's just finding people who happen to restrict their calories for whatever reason, and then looking at how they compare to people who eat normal or high-calorie diet. But those studies do show health benefits to humans, so there's reduced risk of age-related disease, such as cardiovascular disease and diabetes. This may be due to our evolution, so we may have this physiological response to food scarcity that can enhance the body's capacity for survival. There are, obviously most people are not willing to drastically cut back on the number of calories that they're eating, and so some researchers are looking into trying to develop drugs called calorie restriction mimetics that basically mimic these effects without you actually having to, cut back on the number of calories. Those are still in development though. As far as I know, there aren't any that have been like super successful, but it's something that researchers are working on. Some of the reasons that have been suggested though for why calorie restriction might help, one is that it actually reduces the amount of free radicals that you're exposed to. We talked a little bit about free radicals, I think last time or the time before. Basically these sort of volatile substances that can develop, and the more you eat, typically the more exposure to free radicals you have. So if you reduce that, that can help. It also has been shown that having a calorie restricted diet helps reduce inflammation, which can cause all kinds of health issues, and it also improves your sensitivity to insulin, which is highly involved in developing diabetes. So all those may play a role in contributing to the health benefits of calorie restriction. In addition to changes in like fat and muscle, you also have changes to the skeleton and the bones during middle adulthood. In general, the bones start to broaden, but they become more porous, so they have like more holes in them. They're not as dense. Women are at a greater risk, kind of like with skin. Women tend to have lower bone density to start, and then estrogen. Estrogen actually protects against the bone loss, but as you reach menopause and start to have decreased levels of estrogen, then that accelerates the bone loss. This results in loss of bone strength, which can cause the discs of the vertebrae to collapse, which causes sort of the shrinkage that you can sometimes see in elderly people. In addition to that, bones can fracture more easily, so we all kind of have heard the stereotype of like an older person falling and breaking their hip, and that's actually a common occurrence. Because the bones become weaker, it's much easier for them to break and have similar issues. And again, healthy lifestyle, exercise can help with all of these declines. You also have decreased fertility. We talked about how around age 35 for women you start to have this drastic decrease, and it's during this middle adulthood period that most women will go through menopause. The period leading up to menopause, or this gradual period of reproductive capacity declines, is referred to as climacteric, and for women that ends with menopause. For women, once they hit menopause in general, that's basically a complete stop to their fertility, so they're no longer able to get pregnant. For men, they go through climacteric where they're having this gradual decline, but they sort of just continue to have a gradual decline. They don't reach like a sudden point like women do with menopause. Menopause ranges from late 30s to late 50s. On average, most people will hit menopause around early 50s. It is earlier in women who have never had children, and also in women who smoke. During menopause, you basically have a drop in estrogen is the main contributor to all of the symptoms and things that are going on in menopause. So that causes the monthly cycles to shorten and then eventually stop. So you'll stop having periods and stop menstruating. This is accompanied by increased complaints about sexual functioning, also decreased skin elasticity and loss of bone mass. And again, that relates partly to that drop in estrogen because estrogen helps protect against those things. Some of the symptoms that accompany menopause are heat flashes and night sweats. In addition to that, there are sexual difficulties. The decrease in estrogen causes a lot of changes in the vagina, basically makes it drier, makes it less sensitive, so it's more difficult to have sexual satisfaction. So that's one complaint. It also leads to moodiness and irritability. And a lot of women during this time will report sleep difficulties. There have been studies where they use EEG, that's kind of the main way to look at sleep quality whenever someone's sleeping. And those show that there's not really a direct link necessarily between menopause and sleep. However, if you're having hot flashes and night sweats, that can make it really difficult to stay asleep and get quality sleep. And so women who have higher hot flashes are more likely to have sleep difficulties. For most women, those hot flashes will last for about the first 4 years of menopause. And so hot flashes, if you don't, like as the name suggests, is basically where you suddenly just get really hot for no apparent reason and it kind of comes and goes. After about 4 years, that stops for most women, but in extreme cases, it can continue for like decades. Depression is associated mostly with the lead up to menopause during that climacteric phase, but it declines for most women after menopause. And Asian women tend to report fewer complaints, so there are ethnic and cultural differences in sort of the severity. This graph is just showing sort of rates of depression. And if you have a history of depression, then you're much more likely to suffer depressive symptoms during the 4 years before menopause, during menopause, and also after menopause. The most common treatment to help with all these symptoms is hormone therapy. So basically just supplementing estrogen for some, and for others they get estrogen and progesterone. If someone has had a hysterectomy, that's where you have your uterus removed, then they only use estrogen. If you still have your uterus intact, then they use what's called hormone replacement therapy, where it's the estrogen and the progesterone. And that's because progesterone helps prevent uterine cancer, basically. The benefits of this, it reduces hot flashes and vaginal dryness and helps protect against bone loss. However, there are a lot of negative health consequences to doing hormone replacement therapy. You have increases in all kinds of things: heart attack, stroke, blood clots, breast cancer, gallbladder disease, and also an elevated risk of developing Alzheimer's and other dementias. So there are a huge number of side effects to doing hormone replacement therapy. And so it's one of those things you kind of just have to weigh the costs and the benefits. Most doctors recommend that if you have a family history of any of the illnesses or diseases I just named, then you probably shouldn't pursue hormone therapy or hormone replacement therapy. There are alternatives being developed, so there are some estrogen-based drugs that have less side effects. There's also this drug, gabapentin, which was originally used for treating migraines, but it's been shown to have to be pretty effective in reducing the hot flashes and vaginal dryness and helping protect against bone loss, again with much fewer side effects than the hormone replacement therapies. So men also have some reproductive changes, but as I've said multiple times now, it's much more gradual decline. They have decrease in sperm volume and the motility of the sperm starting in the 20s, and then you start to have decreases in the actual number of semen starting around age 40. There's also a gradual decline in testosterone. Men who remain sexually active tend to have higher levels of testosterone because sexual activity stimulates the production of that. In addition to those issues, they also often have difficulties getting and maintaining an erection, which is, what the primary thing Viagra treats, basically. Frequent problems can be linked to anxiety, depression, physical disorders, injury, and also loss of sexual interest. Drugs like Viagra and other similar drugs, they basically just increase blood flow to the penis, and that offers temporary relief to the erectile difficulties.